Welcome back. The CDC approved a COVID-19 vaccine for young children this week, but there are a lot of questions about that inoculation. State epidemiologist Dr. Benjamin Chan is joining us live to talk about the vaccine. Great to see you today, Dr. Chan. And why don't you start by telling us a little bit about this new COVID-19 vaccine for children?
Yeah, so exciting news that Pfizer has a new pediatric COVID-19 vaccine that is now recommended for children 5 to 11 years of age. And this pediatric vaccine, as we're calling it, has the same key ingredients that are really needed to create that protective immune response, but it's at a lower dose than the vaccine that adolescents and adults receive. Even with that lower dose, though, the vaccine still creates a similar level of protective antibodies when it's compared to the levels seen with the higher Pfizer vaccine dose given to adolescents and adults. On top of this, the vaccine clinical trial that was conducted on this vaccine shows that the pediatric vaccine is more than 90% effective at preventing COVID-19. There were no serious side effects identified in that clinical trial, and so the vaccine is safe. And so this lower dose really is the right balance between providing protection, but minimizing the potential side effects.
Now, no children in New Hampshire have reportedly died from COVID-19. So why do you think it's still important for children to get vaccinated?
Yeah, it is important, and children should get vaccinated. They're recommended to be vaccinated to not only protect themselves and their families, but also their communities. We know that children can be infected, and we know that children can spread infection. And when you look at some of the national and regional numbers, about 1 in 4, 25% of all of the new COVID-19 infections that are occurring in children. And so while serious complications from COVID-19 are uncommon in children, they do occur, and they occur even in healthy people. Some of the complications can include serious disease like the multi-system inflammatory syndrome that can occur in children, or MIS-C. And in fact, a majority of the national cases of MIS-C that have occurred in this age group, the 5 to 11-year-old age group. And oftentimes this leads to hospitalizations. And thankfully, while no deaths have occurred in children in New Hampshire related to COVID-19, hundreds of children have died due to COVID-19 and complications across the country. So getting your child vaccinated protects them against COVID-19. It protects other people in the family. And really, it's important to get everybody, give everybody that sort of confidence to get back to normal life.
How about the side effects of this pediatric vaccine? What should we expect in kids?
Yeah, so the expected side effects are generally mild and similar to those same side effects that have been seen in adolescents and adults that have gotten the Pfizer vaccine. This can include local injection site reactions like pain and redness and swelling that can really occur with any vaccine. And also whole body or systemic side effects like people feeling just really tired or fatigued, people having headaches, maybe muscle aches, potentially even fevers and chills. But because this is a lower dose, this vaccine in children is less likely to cause some of these more mild effects of the vaccine.
One of the concerns we are hearing is that the vaccine might have reports of myocarditis, heart inflammation from that shot, also reports of kids who get COVID getting that multi-system inflammatory syndrome that you mentioned. Can you address a little bit more about that?
Yeah, it's a really good and an important question. And so just to clarify, myocarditis refers to inflammation of the heart muscle. There's also an associated syndrome called pericarditis, which refers to inflammation of the membrane, the pericardial membrane around the heart muscle. And there can be various different reasons for somebody to develop myocarditis or pericarditis, including viral infection itself, like infection from the COVID-19 virus, infection from influenza, and other viruses are known causes of heart inflammation. But myocarditis and pericarditis have rarely been reported and occurred in some people after receiving the Pfizer or the Moderna vaccines. More commonly, that occurs in young males after dose number 2. But when it does occur, usually people have resolution of their symptoms with conservative management, meaning treating just the symptoms. But we believe the risk of heart inflammation from COVID-19 virus infection itself is greater than the rare risk of myocarditis after vaccination. And in fact, one study that I've seen estimated that the risk of myocarditis or heart inflammation after infection was maybe 3 to 6 times higher than the rare risk after vaccination. Myocarditis that occurs after infection with the virus itself also appears to be more severe and last longer. And then finally, as I mentioned, the lower pediatric vaccine dose is really meant to minimize the potential for side effects while still offering high levels of protection. So we believe that the benefits and the protective benefits of the vaccine really far outweigh any risks. But certainly we understand people have concerns. If they have questions or concerns about the vaccine, we encourage them to talk to their primary care providers.
Yes, so important to learn all of that data. And Dr. Chan, where can someone go to get their child vaccinated, and how soon in New Hampshire?
Yeah, so multiple areas around the state can and will be offering the pediatric vaccine. Now, CDC has just released their updated, detailed clinical guidance. So we're recommending that parents and guardians, give it a few days for hospitals and healthcare providers to review that, that guidance. And then if they're not hearing from their providers, really to check then with their local hospital or provider office to see if the vaccine is being offered. But there's also commercial pharmacies that are offering this vaccine. We're working with our regional public health networks to try and offer this vaccine in school clinics. So there should be a variety of locations that people can seek out.
Always great to hear from you. Thank you, Dr. Chan. And you can go online to vaccines.gov to find a location offering the pediatric vaccine. If you do still have questions, be sure to tune into News 9 Daybreak tomorrow, because we will be joined by a pediatrician from Children's Hospital at Dartmouth to get your questions answered. You can send those questions now to storyideas@WMUR.com. That starts at 6:30 tomorrow morning.